Hello, I'm Chris McLeod. I'm one of the heart rhythm specialists at Mayo Clinic. I specialize in treating arrhythmias or heart rhythm issues in adults who have congenital heart disease. As you probably know, watching this, one of the most rare but important congenital heart syndromes is Ebstein's anomaly. And there are some important differences that the patient or the family of the patient or friends of the patient should recognize in the management of Ebstein's anomaly as far as the arrhythmias are concerned. It's by far the most common reason that someone with Ebstein's anomaly comes to our attention, especially in adulthood. So there are several different kinds of arrhythmias, and many are picked up in childhood, and we're not going to discuss those. Those are the accessory pathways. They result in rapid heart rates, and very often by the time the patient has got to adulthood, those have been treated with a catheter ablation procedure. It's the sort of go-to, reliable, should-be-done procedure if any child has recurrent symptomatic palpitations or rhythm problems from an accessory pathway. But as the patients grow older, as they enter adulthood, there are a different series of arrhythmias that present, and those are treated by and large somewhat differently from the atrial arrhythmias in patients who don't have Ebstein's anomaly, patients who don't have congenital heart disease. It's a very common group of arrhythmias, these atrial arrhythmias, namely atrial fibrillation and atrial flutter, and they're more common in the older patient who don't have congenital heart disease, so very common in patients over the age of 70, and one of the more common reasons for stroke in patients in the United States. And so we'll start off with just a quick discussion about stroke in Ebstein's anomaly. Stroke really is a concerning issue for patients with Ebstein's, but interestingly, it does not appear to be related to atrial arrhythmias, and this is born out of a very large investigation which we've submitted for publication. It's based on our cohort of almost 1,000 patients with Ebstein's anomaly. There is a real risk of stroke in the younger patient, and we're speaking specifically about adults now, not children, with Ebstein's anomaly, and it doesn't appear to be related to atrial arrhythmias. Why I'm making this point is because the treatment for atrial arrhythmias and stroke, to prevent stroke in patients who don't have Ebstein's and don't have congenital heart disease, is a blood thinner. And very often we can avoid that, circumvent starting a younger patient on lifelong blood thinners if we can recognize that Ebstein's has a different cause for the stroke, for which a blood thinner is not going to be necessary. So a very important difference. And the other is the treatment of the atrial arrhythmia itself. So to prevent palpitations, rapid heart rates, admissions to the emergency unit, and even decompensation and feeling unwell in the context of atrial arrhythmias. These are treated, and there are medications and there are procedures, these ablations, for which I mentioned earlier about the accessory pathway ablations. These ablations are typically very difficult in patients with Ebstein's anomaly, but I do think that the time has come for strategies which employ early ablation as a step to treating atrial arrhythmias in Ebstein's anomaly. There are enough good electroanatomic mapping systems, so it's how we map the arrhythmias with catheters while the patient is asleep, and the results are continuing to improve as our tools are better, our techniques are better, and as experience is better with mapping and ablating atrial arrhythmias. I think this is a very important one because it's often that these arrhythmias are recognized in the patient who has Ebstein's and they are 30, 40, 50 years old, and it's not the typical atrial arrhythmia patient who doesn't have Ebstein's who is 75 years old or even typically older. And so a different strategy, I think, it's still a difficult ablation, but should be considered early on. And then also, just to summarize, there are some important differences in managing stroke, managing blood clots in patients with Ebstein's anomaly. There is another important sequence of events just to make you guys, the patient and family and friends, aware of, is that when someone with Ebstein's anomaly is undergoing cardiac surgery to repair the defect, usually address the tricuspid valve and the right ventricle, right atrium, that we really should look closely at the electrical system prior to the operation, making sure that nothing's being missed, because the surgeon, when he or she is operating on the heart, can do arrhythmia surgery at the time. And so studying the heart from an electrical perspective gives us insight into that and allows us to better shape and streamline the cardiac operation. So there are some excellent centers around the country that specialize in this. Mayo Clinic has by far the largest experience in Ebstein's worldwide, and so we thought we would put this out there. So thank you very much for your attention. Thank you.